Hello, everyone. My name is Robert Linkul, and you're listening to Aging with Strength. This is episode number 2, myth busting of not pressing weight over your head. This is part of a kind of a short series that we're starting this whole podcast series off with. My 5 common practices. If you're watching the video, you'll see all these listed like so, but our 5 common practices working with older adults. And the first one was don't lift anything heavy or anything over 30 pounds. We covered that quite well in episode 1. If you haven't watched that yet or listened to that, please feel free to do so. And today we will address not pressing weight over your head. In the common practice in the personal training industry, this is something that we see personal trainers do with older adults, or all 5 of these are actually, because they just don't really know any better. They're afraid of hurting their clients. They don't really know how to progress them as they continue to work with older pops. The general fat loss goals are wanting to increase their performance when they play golf or they're playing tennis or doing hikes or recreation events. But one of the biggest issues that we face are these overhead movements with the older adults. Mostly because misuse or disuse of the shoulder in the overhead position. As we age and we start to move from youth and sports and activities in life, and we get over usually around age 30, 35, a lot of that participation starts to go away. So if we're not incorporating that into our strength training program or our fitness routine, then that movement, so to speak, just starts to fade away. On a daily basis, we do have opportunities to put our arms over our head. We wave to people. No, I'm just kidding. If you're getting things up and down and out of, cupboards or cabinets, if you're picking your kids up and hoisting them overhead, I mean, the opportunities are actually very few for us to fully lock our arms out over our head. However, that range of motion is so important for us as we continue to grow, even though we're not using that range of motion necessarily on a daily basis. Keeping the range of motion is what's going to keep our shoulder healthy and active if we need it, and also just in every other range of motion that we put it into. So it's like kind of saying, well, I don't need my hips or my back to be flexible more than 10 or 15 degrees. Well, if that's all that you use it for, then that's fine. But what about the one time when you're going to go beyond that? You're probably going to want 90 degrees of flexion and extension inside the hips to help you move and get things up and down off the ground and so on. The shoulder is no different. We see this with falls. Quite often people putting their arms down to try to brace the fall. That's very common. And due to lack of range of motion and lack of strength inside that joint, instead of a sprained shoulder, they get a broken shoulder. Instead of a sprained rotator cuff, they get a torn rotator cuff or a torn labrum inside that shoulder joint. So the range of motion opportunities for us to reach completely to 180 degrees over our head are not terribly common on a day-to-day basis. The ability to do so is very, very important for us. So a couple of statistics here for you, some things that I really love to drive home my points with. Stats, I think, really give us some concrete foundations to get people to understand how often, how common, how valuable this information is. So looking at a couple of things, 5% of our U.S. population has a frozen shoulder. So we're looking at 5% of 319 million people, I think, is where we're at in the U.S. So we've got a pretty good chunk size of folks there that are not utilizing their shoulders all that well. What a frozen shoulder is, and the reason I address that as kind of the first one, is that's the most common one. We had 53,000 shoulder replacements in 2017. A lot of those shoulder replacements are coming from the severe ramifications of years of their frozen shoulder. 22% of our U.S. population has some type of rotator cuff tear and or will have one during their lifetime. So that's a big chunk of people as well. So to cover the rotator cuff and really what is occurring there during a frozen shoulder, we see it a lot with the more common injuries for men or women are impacts on the shoulder. A lot of men who played football or soccer or some hockey, some kind of sport where they're repeatedly getting hit on the shoulders, or the ladies playing lacrosse or rugby or any of the sports where male or female, where they're making contact with their shoulders, repeated motions over and over again, actually hammers down and beats down the meat and materials in the shoulder and kind of warps and addresses from years of those impacts, forces the shoulder down and then, kind of in an internal rotation or compact position, making extension, external rotation, reaching up overhead, rather difficult for them to do. So those injuries will come from athletics. Other ones are from falls, or it's very common, male or female, to have their arms, this is really the one that's listed most often, have their arm reaching behind them or into a kind of vulnerable position during a car accident. And they get this, the most common example, I think, was male or female reaching in the back seat to address a child, to grab something, to get a bag or a purse or a wallet or something out of there, and then rear-ending or someone along those lines. Enough or vital enough to share that information as it was listed in the reports of injuries. It happens very, very often. So you're exposed, your shoulder's in an open, exposed position, and has a violent impact upon it that exceeds the range of motion. So it doesn't necessarily tear anything in there, it just exceeds the range of motion, which is normal. And then that protective nature of our shoulder and our body starts to re-heal, and everything we do, our body-wise, to protect, it wants to pull in and swell and protect and lock down. So if you take the ankle, for example, you're playing basketball or you're running, you trip on a curb, or in basketball, you step on someone's foot, and your ankle rolls, we have these bursa sacs pretty much in every joint of our body. And the bursa sac is like a deflated balloon. And it's a defense mechanism, more or less, to when the joint is pushed beyond a normal range of motion, beyond what it's supposed to be able to do, that bursa sac is activated to swell up and lock that joint down, to not allow it to exceed that range of motion again. So you'll see basketball players, playing on TV, they roll their ankle, you see them go hobbling and walking away. Or in football, they roll an ankle, they hobble away. The next thing you know, they're taping them on their shoe. They don't actually take the shoe off. The pressure of the shoe is around that ankle to increase stability. They tape the ankle down even tighter to keep pressure on that. So they put compression on it, and then they get them back in the game, where they get them moving again, because you want to work all the swelling out of that bursa sac, basically. So the shoulder does the same thing. You have a bursa sac in your shoulder and your elbow and all the, metatarsals, metacarpals of your body, pretty much in every joint of your body. It's a little deflated sac just sitting there waiting to be activated upon need. And that's where the majority of our swelling comes from when we hurt ourselves. So this shoulder will get impact, hit, hyperextended, hyperflexed, some kind of impact will act upon it, that will swell up and create less range of motion and kind of a compact feeling of the shoulder. And then when we hurt ourselves, our natural instinct is, well, we don't want to push ourselves with the shoulder. I'm going to protect it and keep it close and keep it tight and not move it very much. So now it's become injured from an exceeded range of motion. It's swelling, it's locking down, and we're not using it as much. So we have all these actions. We should be doing the exact opposite, trying to increase the range of motion, reduce the swelling, and keep using it so it doesn't lock down. But we're aiding that lockdown effect by doing all the things that we think are good and healthy for us, not using it, protecting it, wrapping it up, keeping it in one place, keeping it close to us. So these are the issues that kind of come over and over again with the shoulders. And then even without injury, we just start to age and we focus more on our computers and our work and, our desks that we're sitting at and our cars that we're sitting at, and everything's in front of us and below the shoulder and easy access, and we don't really have to reach or use it much. So that range of motion just becomes kind of obsolete. We just don't use it. So in our industry, we have that saying that if you don't use it, you'll lose it. And this is one of the more common ones that will occur. We will lose our ability to reach overhead, to have external rotation, really, to reach and externally rotate are kind of the two big ones that come in with the frozen shoulder. And being that the most common shoulder injury, one of the biggest correlations over to the older adult is that frozen shoulder. So naturally, we tell all these other trainers, common practice, that you're not supposed to press weights over your head or even put your arms over your head. And I'm here to tell you the exact opposite. We really want them to be able to do that. So a really good test, or something that you want to take yourself through if you're someone with a frozen shoulder, or if you're having some concerns that this might be you in the future, I used to do clean and jerks and snatches and all these lifts when I was throwing the hammer back in the day, where I put my arms vertically over my head over and over and over again. And since then, I find myself daily demonstrating to my clients, but not doing a ton of those reps. So even I have concern about it, to make sure that I keep this range of motion and keep my ability in my shoulders, keep them healthy. So something that you can do to test this is lay down on the floor, lay down in your bed, wherever you're comfortable at, knees bent, just to make sure your back is well supported, not over or hyperextended. And just try to take your both your arms and put them straight up in the air. So if you're laying down flat, we're going to call that 0 degrees. You're going to reach your arms straight up in the air, or they're going to go up at 90-degree angle, and you're going to try to reach them all the way overhead. You put your thumbs up and try to go all the way overhead and touch your thumbs to the floor behind you, but with your arms totally straight. And then bring them 180 degrees all the way down, right by the sides of your pockets, touch your pinkies to the ground. Try that 2 or 3 times, just 180 degrees of rotation, all the way up overhead, touch the floor with the thumb, touch it with the pinky, 2 or 3 times. If you're feeling any pain, discomfort, impingement, meaning there's a range of motion where you kind of stop and go around it, you feel yourself wincing, you feel yourself avoiding one specific spot because you think that it's going to hurt, you're anticipating pain, that would go to show that this is an inactive activity. This is gravity acting on your arm and relaxing as you reach back overhead. You're kind of letting go of the muscle and just letting gravity pull your arm back. So for the most part, not everybody, but for the most part, if you're having trouble with this, there's some kind of structural damage inside your shoulder. It's not a muscular issue necessarily. There might be something structurally wrong that you need to get checked out from there. If you can do this range of motion and there's no pain and it's good, then the next one is to stand up and try to do it. So now gravity is pulling down on the arm. It's not pulling back, trying to work with gravity to relax. We have to actively move our arms from our sides all the way overhead, 180 degrees and back. And if we're seeing a lack of range of motion or pain that kind of kicks in then too, now we're seeing this might be more of a muscular issue than it is a structural issue. Either way, both are repairable, fixable, and provable. Just depends on the issue and the limitation. And not having seen all of you listening or know exactly specifically what's wrong, it's hard for me to advise on here's what you should do. But I'll just kind of give you some advice as to what we do at Be Stronger Fitness, what I do with my older adult clients, and then how you can kind of maybe work some of those things in. But again, step number 1 would be to get with your doctor, physical therapist, personal trainer, your team of health professionals, and have a really good evaluation and make sure that your shoulder is safe to do some of these things before we do it. But we'll start with those inactive or passive stretches like we talked about first. Laying on the floor, we'll check that. And then we'll work on their standing or their active component to reach overhead and get a range of motion there. And beyond that, as we start to train, the shoulder is typically more comfortable in a neutral position. So if I'm standing, pointing my thumbs at myself, like who has 2 thumbs and is bald? This guy, right? Like that kind of thumb position, that's we're going to call neutral position. And then you could rotate, or 0 degrees. You can rotate out to like 45 degrees and then out to 90 degrees, which would be your typical military press angles where you see. Any kind of overhead pressing angle, in my opinion, the further we rotate out towards 90 degrees, the more the shoulder is going to be placed on stretch, and the more difficult the movement might be going overhead. So I like to try to work my clients in by starting at 0, that 0 degree angle or the neutral degree position, and just working on them pressing their arms directly overhead, one arm at a time. That's called unilateral movement. A lot of times our body will mirror itself. So if you have one healthy shoulder and one challenged shoulder, the healthy shoulder will not exceed a normal range of motion. It'll stop to the injured or to the challenged shoulder. So I like to work on them independently. There are some bilateral dominances as well, where if you're holding a barbell or a cable and pressing with both arms on one implement, your dominant shoulder, your unilateral dominant shoulder, the stronger arm, will do more of the work. And though the movement is occurring, the stronger arm's kind of compensating and doing more. So how do you break away from that compensation and get each shoulder independently to work on its own and build its own strength? You train each one independently. So my favorite exercise we do right now is called a post press. You push one hand down at 90 degrees in front of you, like you're pushing your hand on the wall, trying to push it over. We have posts in our gym or on squat racks that we use. So we engage the hand around that and we actively push. So I'll demonstrate with my left arm, or cue you through with my left arm, is pushing on the post, and it's active. I don't just put my hand on the wall and relax. I'm pushing like I'm trying to knock the wall over. So that arm's out at 90 degrees, and then I'm going to do my 0 degree, my 2 thumbs up, this guy, by position with my right hand, and press directly overhead up to 180 degrees if I can, or bicep to my ear, and then return back down. And we'll start this with 2.5 pound dumbbells, 5 pound dumbbells. The most important component to it is getting your arm all the way to 180 degrees. Most people will press their arm overhead and they'll think I'm there, and really they're 15 or maybe even 20 degrees short. And so if you can envision having your arm over your head and looking to the right to see if you could see yourself in the mirror, okay, and if you're watching on the video here, so I press my arm overhead, most people will get to about here, and they'll look over and they have to look around their arm to see themselves in the mirror. Our goal with 180 degrees is that your arm is all the way up, and when you look over, you can see your entire face behind your tricep, basically. Your arm is completely out of the way. So the goal with that is to use the post as a reference point of what is vertical, use a mirror to your side to push over and see, and make sure that your arm can completely reach 180 degrees. And as you increase in weight, typical twice a week, 2 to 3 sets, anywhere from 8 to 12 reps is kind of a good safe range to push in there. Challenging yourself, but able to get that weight all the way to vertical with each arm independently all the way up. The other question I get is, well, I could do more with my healthy arm, my right arm, than I can with my left. Should I increase weight on the right and not on the left? Absolutely not. You are as strong as your weakest link. And so if you have a 20-pound overhead press on your right arm and only a 10 on your left, and we continue to increase on both, we're always going to have this 10-pound difference. So I would rather just maintain strength on your right arm, your healthy arm, and increase the weaker arm until it's equal, and then build those two together. So now we no longer have a limitation. We don't have the greatest potential to train the right arm, but we're not trying to just train your right arm. We're trying to train you as a whole. So I want to get both arms even. Find that unilateral dominance as basically being neutral now, where both arms are independently strong, and you're able to build strength vertically with those two as we go. We're increasing range of motion. We're increasing strength load on that shoulder, and we're keeping a range of motion in that shoulder that's going to be healthy for any impacts that come your way, falls, opportunities to carry loads, press weights over your head, and so on. So all of these are very important components, in my opinion, to make sure clients are and people are keeping their arms capable and able and strong, pushing in the overhead motion. Some of the surgeries that occur from the frozen shoulders, they have something just called a manipulation, though it sounds rather brutal. When you have a frozen shoulder, there's technically nothing wrong with the ligaments and tendons in the shoulder, just from not using them or from the impacts. Everything's kind of locked down and it's lost its range of motion. So they will just knock you out, tie you down to the table, and basically just snap your arm back into place and circumduct it around and just move it and manipulate it until everything starts to loosen up. And I believe, I don't know exactly, but I believe they do some steroid shots in there and some other things to help the process, but it's a rather brutal opportunity. If that's something that's in your future to do, I do not suggest watching the videos on YouTube of what this looks like, because it's a little gnarly. If you're not going to have that and you want to see something that's just really brutal, then go for it. But I don't like subjecting myself or subjecting people to stuff like that. It's not that they're doing damage. They are actually fixing you. It's just they're not gentle with you by any means. Before my hip replacement, my first one, I watched the video of one, and I got sick. I was just like, I can't believe I'm going to let this happen. The hammering and the drilling and the chiseling, and it's like something that would happen in a woodshed rather than in a surgical environment. But it's very much so the way they have to do it. And you can see why people are all sore and take weeks to rehabilitate. But I'm upright and walking and comfortable this day thanks to that procedure. It's just a little brutal to see it. So manipulations are a great way to fix. In some cases, you do have tears either to the labrum or the rotator cuff or some of the musculatures. It could be bicep tendon, anterior deltoid. It could be any of the muscles in the shoulder joint that are going to give you some issues. Physical therapy can address and fix some of those. In some cases, you have so many different highways weaving around one area in the city, if you will. So many things in that area that sometimes nerve pinches can occur, blood flow restriction can occur. And basically, you'll have musculature that will die. It's not getting the nerve signal anymore, or it's not getting blood flow. So you have 4 rotator cuff. It's not cup, by the way, C-U-F-F, cuff, the rotator cuff musculatures. can basically die off. And when you get an MRI, you'll see 3 of those rotator cuff muscles come in white and 1 is completely black. And that one means that that material is dead. There's no life to it anymore. Some can be resurrected, some cannot, but I don't know much more about it than that. So some surgical procedures will need to be done to fix some of those. There are many options they have in doing that. They can go in and use a part of your hamstring or a cadaver piece or a pig part, or there's all kinds of options. So again, I don't know a ton about that, but just to give you some idea, some options that occur. And then the ultimate is kind of getting that shoulder replacement. I think I was telling you 53,000 shoulder replacements in 2017. And it's a really challenging rehabilitation of the shoulder just because that joint is such a hard joint to rehabilitate. You have 3 different bones more or less that they're having to pull out and repair, where with the hip or the knee, it's 2. I mean, you have the patella as well, but typically that stays or it's removed in one piece or whatnot. So the challenge of the shoulder, I have yet to work with someone that's had a shoulder replacement. I know a very good friend of mine that has had one. He rehabilitated it very well. My experience has been with hips and with knees and all kinds of different back surgeries. But I do know that the number of shoulder replacements is on the rise. And in many, many cases, I think it was 65, 70% started with frozen shoulder symptoms. So if we can address this right from the get-go, get the idea that pushing weight overhead is something that everybody needs to do to get away from this phobia that pushing weight over your head is going to hurt you, then I think we're going to save a lot of these limitations and issues in the future. When I tell people, especially older adults, that you need to lift weights, I'm not saying you need to lift super heavy weights, but you do need to lift weight that is challenging. Okay, holding 2s and 5s and 7-pound dumbbells are great to start off with your first couple of weeks. And then eventually, male or female, you need to lift heavy loads. This is a component to our body, as we talked about in episode 1. If you haven't listened to that yet, I encourage you to do so. I go through something called the SAID principle, the specific adaptation to an imposed demand. And if you are not imposing a heavy enough demand on your shoulders, you are not going to have a specific adaptation of the musculature in that joint or the bony structures in that joint to give you the result that you want. So you really need to learn to press weight. And I listed this as heavier weight on the podcast on purpose. Not heavy, but heavier than what you are comfortable or what is feeling natural for you. Because if it's comfortable or natural, you have to get uncomfortable with this weight. And what I mean by that is challenged, not uncomfortable like it's hurting you, okay? That's when change will occur. That's an imposed demand that your body will specifically adapt to. All right. One last stat that I didn't have a great place to throw this in at, but 20% of diabetics get frozen shoulders. So that was a extra or added component to having diabetes, is also that you have a 10 times greater chance of frozen shoulders as opposed to anybody else. So it shows how a lot of the injuries and health issues that we have, they piggyback up on there. You start to get decrease in blood flow with neuropathies to the hands and the feet. Remember, all that blood has to travel all the way through to get to those distal ends of the body. So you're going to have restrictions of blood flow and nerve signals in other areas as well. And so the last thing we want is for you to start losing sensations, losing abilities, feelings, blood flows, all that. All of this is geared back towards me and our industry helping you increase your quality of life. I hope you enjoyed this podcast. I hope you enjoyed this information. If you have questions, feel free to list them below. I'm happy to answer them. If you have a topic that you would like me to cover in the future, also throw that up there. I have a buttload of them that I'm going to go through, but if I have a lot that are very common and asked on the podcast posts, I'll be happy to do that. Hopefully you're following and sharing out this information to others. This information is all geared towards people of all kinds, shapes, ages, male or female, over 50 or not. This is all great information. It's not just geared towards your personal trainers, but all of us. So again, geared towards and focused on improving your quality of life. My name is Robert Linkul. Thank you for watching Aging with Strength or listening to Aging with Strength, and we'll see you next time.